Well, good afternoon, everybody. This is the second webinar by the Healthcare Working Group in Transplant Child. The topic for today's webinar is the map of the European Union pediatric transplantation activities. And the Healthcare Working Group, through a multidisciplinary collaboration group, decided to define the European Union map of the pediatric transplantation activities, including both solid organ and hematopoietic stem cell transplants. This project was agreed by all the attending authorities in the meeting that was held in Brussels in June 2018, and was agreed that the transplant child was going to put together the pediatric transplantation in Europe to deliver a complete map of the activity and expertise in pediatric transplantation. And at this point, I want to wish to acknowledge the support of the Unit B4 of the Medical Products in Quality, Safety and Innovation of the DG Health and Food Safety, SANTE, for the kind invitation to this meeting that again was held in Brussels in June. Without their endorsement and the generous collaboration of the representatives of each of the European competent authorities on organ donation and transplantation, this work I'm going to present to you would have been not possible. Well, the objectives of this project, this map, are several. The first one, we want to define who we currently are and who are not but should be. We want to locate the specific experience, expertise, and knowledge in a field, as you all know, as wide as pediatric transplantation it is. 4 different proposals to form advisory group members in the advisory treatment platform, CPMS, for education and training activities, and for the development of clinical guidelines on pediatric transplantation. We want to evaluate the application of new members, but under criteria that provide added value to the network. We want to extend the network to all European Union member states and thus provide access to the network to all patients and families, as many patients and families. We want also to increase the number of patients in the network for different reasons, for including them in registering and research projects, just to increase the potency of these projects. We want to analyze also the number and distribution of existing centers and transplantation programs. And at the end, we want to analyze the equity in the access to transplantation for pediatric candidates all across Europe. Well, to achieve this goal, we kindly request the collaboration of all European national and supranational agencies to provide us with the pediatric donation and transplant information between the years 2012 and 2016, 5 years, including all information on transplanted patients under the age of 18 was collected, including, as I say, the number of pediatric solid organ transplantations by type of organ, kidney, liver, lung, heart, and intestinal. Also the number of pediatric hematopoietic stem cells transplantations, and also the number of transplants, both solid and hematopoietic, per centers of each country, including all member centers activity, member centers in transplant child, but also all non-member centers at the moment activity outside transplant child. This slide, you can see all the agencies, as I say, national and supranational agencies in different countries that have kindly collaborated in this project, in this work, and without the help, this had not been possible at all. So thank you to all of them for their kind collaboration and support. Well, the collection of data, the data collection, the information was required in a determined form, and each agency should be structured activity data according to the following instructions. The information had to be divided by hospital, by centers, should be separated by age, one group of patients younger than 16 years old, and a second one for those between 16 and 18 years old. We wanted information separated by the type of transplant, hematopoietic stem cell, and the different types of solid organ transplantation. The information of the range of years from 2012 and 2016 as an optional for liver and kidney transplantation. We asked for the data were discriminated by the type of donor, either liver or cadaveric donor. In the case of the hematopoietic stem cell transplantation, the data were divided by autologous or allogeneic transplant. Before I start giving you some data, some numbers, I want to clarify different aspects. First, the total data of hematopoietic stem cell transplantation is represented by the data collected from European Bone Marrow Transplantation Society, MBTS, from transplanted patients between those 5 years. Data of this hematopoietic transplantation between 0 and 16 years and 16 and 18 years are represented by data collected from national agencies, excluding the following countries: Bulgaria, Spain, Italy, Lithuania, Poland, Portugal, and the supranational agency Eurotransplant, including those members that are shown in the slide. Third, France and Poland data are represented only as a total transplantation activity and not divided in those periods between 0 and 16 years and 16 and 18 years. In the case of Romania, we only have data of the hematopoietic stem cell activity. We are expecting to receive the data from the solid organ transplantation in this country. In the case of Scandia transplant data, including Denmark, Finland, Iceland, Norway, and Sweden, are only for patients below 16 years old, and they have sent us only the information regarding the total country activity, and it's not divided by centers, by the different healthcare providers in those countries, in those states. The transplant child activity from the Hospital Necker, Paris, Hanover Medical School, Wilhelmina Children's Hospital, Karolinska University Hospital, and Children's Hospital, Skanes University Hospital, were updated only with the data provided by their transplant teams during the years 2015 and 2015. We didn't obtain data from the agency, but only from the different centers, these centers I have just mentioned now. Well, this in blue you can see the countries, the European states that at the moment present have some representatives in transplant child in blue, and in red the countries without any representative in transplant child. As you can see, the countries with representatives in transplant child gather the highest amount of pediatric solid organ transplantation in 2016. Well, you are going to find in the Transplant Child web page several interactive maps where you can consult all this data and much more. You only have to select the country. You can select the data by country, by type of organ transplanted, and by the years as you want. So you can obtain all data by selecting the corresponding items in this interactive map that again you could find in the Transplant Child web page. Well, this is the total activity of pediatric transplantation in the European Union in those 5 years. A total number of transplant 22,000, more than 22,000 transplants in those 5 years, divided in 14,595 hematopoietic stem cells transplants and 7,463 solid organ transplants. In the right side of the slide, you can see the total number of transplants in per country. As you can see, are some countries that with more than 3,000 transplants in those 5 years. United Kingdom, Italy, and France, and two countries with between 2,000 and 3,000, as are Spain and Germany. And as you can see, on the other hand, countries without no pediatric transplantation activity in those last 5 years, as Luxembourg, Malta, or Cyprus, and countries with really low number of transplant in children those 5 years. But if we have the rate of transplant in every country, but per million of population, we obtain some different data. As you can see, countries not with the highest number of transplants, when we consider them with this related to the population, the millions of population, they are in the highest position, as Belgium, Sweden, UK, France, etc. In some way, this rate of number of pediatric solid organ transplants by million of population is showing us in some way the accessibility to transplantation, to solid organ transplantation by children in those countries. Maybe some of the countries with the lowest rates in this rate probably have developed some kind of agreements with other countries for transfer of patients for transplantation in other countries. But I think it's important. I think I want to outline these rates because it's offering us this information about how many chances of being transplanted in each country has at the moment a child with who is a candidate for pediatric solid organ transplantation. Well, if we analyze the activity by type of organ, as you can see, the highest rate is for hematopoietic stem cell transplantation, with more than 14,000 transplants in those 5 years, more than 3,000 kidney transplant, 2,800 liver transplantations, 900 heart transplantation, 300 lung transplantations, and 84 intestinal or small bowel transplantation in those 5 years. On the right side, you can see that the activity in every type of transplantation, in every type of organ transplanted, maintained stable across all these 5 years. Well, this slide I'm not going to comment because it's a lot of data on it, but you can see the distribution of pediatric transplantation activity per country and transplanted organ. Again, you could also find all this data and all these graphics in the Transplant Child webpage. At the end, I will give you the link to uh, for accessing all this information. Well, you could find in this page also um, the transplantation activity by centers, by hospitals. You could see in different colors the different types of organ transplantation, and you can have all the information by countries, by type of transplant, by every center, just clicking in the left side of the interactive map you could find in the Transplant Child web. This information is also divided for pediatric transplant between 0 and 16 years old and from 16 to 18 years old. Two different maps that you can consult and um, you can have information in these maps. Well, when we analyze the number of centers by type of transplant that have performed at least one transplant in those 5 years between 2012 and 2016, we found that there were 232 centers or programs in hematopoietic stem cell transplantation that have performed at least one transplant in those years. 145 programs in kidney transplantation, 86 in liver transplantation, 76 programs in heart transplantation, 37 in lung transplantation, and 9 active programs in intestinal transplantation in Europe, in the European Union. But when we analyze the average activity in those centers, in those programs, we define 3 different categories. Centers that are performing less than 2 transplants a year as an average, centers that have transplanted between 2 and 10 transplants per year, and centers that we can consider with a high activity transplanting more than 10 transplants a year. And as you can see, most centers are in the lowest category. We between 55% in the case of kidney transplantation to 63% in the case of heart transplantation. Centers are performing less than 2 transplants every year. By the contrary, in the other hand, only 16% of the centers with kidney programs are transplanting more than 10 transplants a year. 20% of the centers with liver transplantation programs are transplanting more than 10 transplants every year, and 3% of the heart transplantation programs are doing more than 10 transplants every year. So most centers are performing a very low activity, and only just a few centers have performed more than 2 and specifically more than 10 transplants every year. I think it's an important data. Well, the last slide regarding Transplant Child, we have now 18 members from 11 different countries in Europe. And also in the Transplant Child website, you can obtain the data from the centers at the moment members of Transplant Child for these 5 years. You can consult by country and by year. As you can see in the left side, the centers that at the moment are members of Transplant Child only gather the 20% of the total transplantation activity in children in Europe. So that means that probably we have a huge chance for expansion of our network. But this representation is not the same for the different organs, and we have, I think, a a very good representation in the liver transplants with almost 50% of the European activity gathered in the centers at the moment members of Transplant Child, or um, almost 70% of the activity for multivisceral or intestinal transplantation. By the contrary, in Transplant Child, in those 18 centers at the moment, members of Transplant Child only gather the 13% of the activity in hematopoietic stem cell transplantations, or the 17% of the activity in heart transplants. So in some way, these data are indicating as um, um, which type of centers, which type of activity we have to look for in the future, um, incorporating new centers in Transplant Child to increase our experience, expertise in some type of organs that at the moment, organ transplantation, that at the moment can be considered as underrepresented in Transplant Child. Well, this is the Transplant Child members activity during those 5 years, divided by centers, the 18 centers, and by the type of organ transplantation they have. You can see that our centers, we have centers with activity in all six different types of pediatric transplantation, and also we have at the same time centers with only activity in one type of two or three types of pediatric transplantation. And that's all. Thank you very much for your attention. Um, this webinar will be uploaded to the Transplant Child webpage, so you can see it at any moment you want. And very important, again, I have repeat several times during the presentation, you all these data and much more of them are available in this direction in the Transplant Child web page, and please consult it. And you see any data that you consider could be an error, a mistake, please tell us, and we'll be delighted to correct them so we can have the best map in European pediatric transplantation activity. Thank you very much.